everybody. It's your girl, NickyNicole of Divas of the Round Table podcast. I'm joined here today on the show by Miss Tresonda LaRalle. Tresonda LaRalle is an advanced practice registered nurse and a board-certified nurse midwife with 26 years of clinical and didactic experience. She is a graduate of Florida A&M University, also earning her bachelor's in science degree in nursing from the University of Florida with a minor in elementary education. And she got a master of science in nursing respectively. She is 12 credits away from earning her doctorate in nurse practice. She's a women's health expert and a certified stroke nurse. Among her copious awards and accomplishments, she is the first African-American graduate of the Mayo Clinic Jacksonville perioperative nursing program and the first African-American registered nurse on the heart and lung transplant team for Mayo Clinic. Her success in leadership and academia has resulted in her of her sincere love for people and for the nursing profession. An innovative visionary, she is a highly sought after business consultant and orator. She consistently serves the community, volunteering through various agencies and on various boards. She is currently the Chief Executive Officer for Global Health Organization, a consortium of leading industry healthcare providers and consultants that serves as contracted healthcare providers. She is a certified life coach, where she is the founder of Healing the Healer, Caring for the Caretaker. She is also the founder of Florida College of Nursing, a certified nursing assistant training program targeted at transitioning single mothers from poverty to careers. She is a certified academic language therapist and the founder of Eagle Academy, a tutoring service that bridges the gap between illiteracy in minorities, specifically targeting African-American males. She wears many hats. Among those, she is also the wife to Florida A&M alumni and attorney, Averill Thompson, and she is the mother of two sons, Wisdom and Dominion. Ladies and gentlemen, please welcome to the show, Miss Tresonda LaRalle.
Thank you
for coming to the show.
Thank you so much for having me.
It's been a while. We've been trying to work it out. We've been trying to get it together.
That's okay.
Thank you. So we tried last year to try to get a show together and have you on. And I think everything happens when it's supposed to happen.
Right.
So here you are with us today. And today we will be talking about women's health, also like talking about gynecological things and diseases and stuff like that goes on with women in today's society. I believe a lot of people kind of shun away from those particular topics, but it's a topic that affects everybody, whether you have one or whether you're in love with one or married to one or whatever. That's something that the discussion on female health is a serious issue.
It's very important.
Very important, very important. So what made you go into the field of gynecology?
I desired to be a nurse, first of all, since I was 5 years old. Mm-hmm. My mother is a registered nurse, and I have several aunts that are nurses.
Okay.
So around the age of 5 for me, several of my aunts were getting pregnant. Okay. So I've always been very inquisitive. Okay. So I wanted to know, why were their bellies getting big? Where was the baby going to come from? Mm-hmm. At the same time, my mom was going to school. Okay. And she was going to actually what is now Florida State College, but back then it was Florida Community College. Mm-hmm. And she had a professor, Dr. Baker, and she was teaching her anatomy and physiology. Mm-hmm. And I remember my babysitter wasn't able to keep me one day, and I went to school with my mom. And when I went to school with her, Dr. Baker gave me a paper of a heart. And she started, while she was teaching, I had to color that paper. And then afterwards, she came up to me and explained everything and asked me questions about the lecture that she was going over. So that, along with going and passing out tea tea and snacks at nursing homes made me know that I wanted to be a nurse and care for women. Or care for people. I decided to care for women specifically. I knew that I wanted to do it because I love babies and I love children and I love healthcare. So it allows me to combine my passion of serving others, caring for people, and care for babies. I believe that when you select a career, you need to do something that is not work.
Yes,
it needs to be something that just comes natural for you and that you are more so called to do, and you can do it every day for the rest of your life.
Yes, I totally agree with that. So I found out like the older I get and the more I see things on social media and just having conversations with people, I know I found this to be what I believe is true, but do you find that a lot of women really don't know their bodies?
You know what? A lot of women do not know their body. They don't know their body. They don't know how the body functions. They don't know what's normal, what's abnormal for them. And especially in our community, a lot of things we think is just normal and it's really not normal. There are symptoms that actually manifest in the body, be it gynecologic symptoms or even just general health, primary care symptoms that manifest that we think that is just a part of that's just how we are. For instance, I've seen a lot of people, they would say they would have like discoloration of the skin and they would have like splotches on their face or splotches on their arm. And they would say, oh, when I was growing up, I would hear people say, oh, he just drank too much soda. She just drank too much soda. She has acid on her from drinking that soda. That's actually not acid. It is a result of drinking too much soda, but it's actually a manifestation of pre-symptoms or perhaps even symptoms of diabetes.
Oh, because I've heard that about the acid on the skin. I've heard that.
It's actually a fungus.
Oh, wow. Yes, I've heard that. Okay.
So, and it warrants not only treatment of the irritation on the skin, but it warrants further investigation for diabetes testing.
Okay. Okay, that's something good to know. So you guys, if y'all know somebody got that acid on the skin, it's not acid on the skin, they need to go and seek medical help and get it investigated a little bit farther. I wanted to go into this issue here.
I want to add one other thing with that. With women specifically, if you are getting frequent vaginal yeast infections, it could also be a sign that you are becoming insulin resistant.
Yes.
And therefore developing diabetes.
I recently knew somebody that happened to, that they kept battling it for a few months. And they say, I know they was in the hospital.
Yeah. A lot of times women will, you can see that you're getting a lot of yeast infections. I see a lot of women that get a lot of, they call them risins. The lay term is risins or growths under their arm or either growths. The medical term is carbuncles on your butt, on your gluteus maximus. That is also a sign that you are insulin resistant and you need to be tested for diabetes. So that happens a lot, and I see a lot of people end up getting staph infections from that. And is in the staph infection, it actually becomes worse and worse, and it's because that they haven't been diagnosed with diabetes.
Oh, wow. Okay.
Yeah.
So yeah, those risings, get yourself checked out, people. And the acid, what we say is acid on the skin, which the medical term is not that. What we call acid on the skin could be a precursor to a person having diabetes. Okay, I wanted to get into this too, because this is something, it's been a brunt of a lot of jokes with men and some women, but you mostly see men joke about this thing. How important is it for having proper pH balance in the vagina? And what level should a woman, kind of a range should a woman be in to be considered, healthy?
Well, here's the thing. First of all, what men are talking about pH balance? What is prompting a man to say that a woman is not pH balanced? Is it
normally the vaginal odor?
Okay, yeah. So if it's the vaginal odor, then that is called bacteria vaginosis. Mm-hmm. So that is actually a bacterial infection in the vagina. Mm-hmm. So what happens with that, the vagina does need to be pH balanced, but it has normal flora and abnormal flora. Mm-hmm. And when that abnormal flora gets off balance, mm-hmm. then women will start to experience what's called bacterial vaginosis. Now, to all the men that are listening, and you are confronting women with their vaginal odor, let me break some news to you. That bacterial vaginosis is often, if you are engaging in intercourse and you're engaging in intercourse without a condom, then your semen is actually what's causing that woman to become pH imbalanced, and is therefore the etiology or the cause of the odor that you're smelling.
They are the cause.
Now, of course, hygiene does play a part, but a lot of times I want to make it very clear that oftentimes it is because women are engaging in intercourse, and especially if you're engaging in intercourse with multiple partners, then you're engaging in intercourse with multiple pHs of semen, and that is throwing your pH balance off. Okay. Also, women tend to, someone put it out, that you're supposed to douche. And I know, oh my goodness, somebody is grabbing their invisible pearls mm-hmm. on douching, because you think that the solution to the odor is to douche, but that is not the solution. Yeah. The solution to the odor is to treat the underlying problem of the bacterial vaginosis, or it could be another disease, possibly even a sexually transmitted disease. Mm-hmm. So the solution is to treat the underlying problem, and then with a prescription medication, and then you'll see that odor would subside.
I know it's become popular lately, these past few years, these little pearls and these yoni pearls that, women are putting inside themselves and stuff, that's supposed to be like stuff comes out, and they say that's all kind of yuck and guck that comes out, but it's putting a foreign object, putting something that don't belong in there. I've never thought it was a good thing to do, put those things in, people do these little yoni pearls. Have you heard of these?
I have heard of them. I am not a fan.
Yeah.
Yeah, I do not recommend those, but I know that it is something that is very popular. Yeah. Here's the whole thing with the body. The vagina specifically, if you would take your tongue and feel the inside of your cheeks, mm-hmm. the vagina is a mucous membrane. So the inside of your cheek is a mucous membrane. So it is designed to be moist. Mm-hmm. It is designed to be warm. It has what's called rugae or folds in it. So the vagina is designed to basically keep itself, and it keeps itself based on what you put inside of your body internally. So if you're eating food that is high in carbohydrates, that is causing your insulin levels to spike, which when you eat food that are high in carbohydrates, such as sweets, sodas, candies, pastas, bread, mm-hmm. potatoes, all of that will cause your insulin level to peak up. When your insulin level spikes, mm-hmm. then it stays at a certain level. When it stays at that certain level, it causes estrogen to be released. When that estrogen is released, estrogen is stored in fat cells. So there's a whole process that goes on that affects the pH of the body that has absolutely nothing. It does not solely have to do with your hygiene, but it also has to do with what you take into your body. There's also something I've had a lot of people ask me about eating. Does eating certain fruits affect the way that your vagina smells or tastes? Yeah. Yeah. So, and once again, whatever you put in your body, it will be excreted out of your body. Okay. So it does have some effect. I do not know about what the urban myths are.
Yeah. Okay.
I don't know about that, but it is to a woman's advantage to pay particular attention to what she's putting in her body.
Okay.
And I do not recommend douching. I do not recommend the noni pearls because once again, it is a foreign object. And anytime you put something foreign inside of your body has to then fight to become homeostatic or to reach a homeostasis place.
Makes sense.
Yeah.
It does make sense. Let's see. The next question I have, I said, women are born with all the eggs that we will ever have. What does it mean in terms of women getting pregnant later in life? Is there any, does the eggs age, and you know what I'm saying? Like, because we're born with all of them that we will ever have. Men produce sperm daily. Women, we're born with all the eggs that we'll ever have in our lifetime. So is there a difference in a woman being older having a baby? Is there like the vitality of the eggs or the eggs having more spunk when they're younger or older? Is it a difference in the age?
Well, let me say this first of all. Both men and women are born with all the seeds that they're ever going to have.
Oh, really?
So, right. So a boy or a man is born with all the sperm that he's going to have. It's not like he's continuously producing sperm. And a woman is born with all the ova that she's going to have. So what happens is not necessarily, of course, like how long the egg lives in your body, but you can continue to get pregnant once you're up in age. It's a matter of how you're caring for your body and what you're putting in your body. The egg, a baby develops and it gets all of its nutrients and nourishment from the mother.
Okay.
So whatever state your body is in, when you conceive, then that is going to greatly affect the baby. Now, here's the unique thing that I love the way that God just made our whole body. And the way that he made our body is that baby is designed to thrive. So the body is going to give, when you get pregnant, it's going to give that baby everything that it needs. I just spoke with a young lady this past week, and she's actually pregnant with triplets. And she was saying that she doesn't take her prenatal vitamins and she doesn't feel like eating and all of that. So I was encouraging her, it's very important for you to take your prenatal vitamins every day. And it's very important for you to eat, even if you do not have an appetite, you need to eat and make sure you're eating healthy foods. Yeah. Don't give in to the urges of sweets and sweet drinks or what have you that you're having. Why? Because if you don't give your baby anything to eat, then your body is going to pull the nutrients from you. Yes. So that's why women tend to end up having a lot of dental problems once they get pregnant, because babies need calcium in order to develop their bones. Yes. So if you're not replenishing your store of calcium, then guess what? That baby is going to pull calcium from you, and it's going to affect your teeth. And that's women tend to lose teeth a lot.
That happened with me with my oldest son. I wasn't taking the prenatal vitamins, and I wasn't big on milk and, a lot of foods that was calcium rich. And I didn't have problems with my teeth, but my bones ached. And I mean, remember like hobbling like on one side, just one side was really, like my bones was aching. It seemed like, and my father, God rest his soul, he set a thing of milk down and told me to drink it. He was like, you need to drink and feed that baby because it's pulling from you. That's what he told me. And we're talking about a country guy from Mississippi that knew that. You know what I'm saying? And I still remember that because I hate drinking just plain milk. It's got to be cereal or maybe milk and cookies or something. But he made me drink milk and got on me about taking my vitamins because I wasn't. And my baby started to pull from me. So that is absolutely correct.
Right. And we have been taught that milk is the go-to for calcium or for, our nutrients. And that is, if you think about it, milk is from a cow, and in order for us to be able to drink it, it has to go through processing. So I'm not saying do not drink milk, but you should get your minerals and your vitamins from fruits and vegetables, from especially when you're pregnant. If you're eating broccoli, if you're eating like sweet potatoes, if you're eating your green leafy vegetables, those are all very good sources to get your nutrients and your minerals from.
Okay. I'm thinking I wasn't eating none of those back then. Maybe some collard greens every now and then, but I wasn't eating none of that stuff, which I do now. Mm-hmm. But at that time, I definitely was not eating any broccoli, none of that. Yeah. Sweet potato, only sweet potato pie, which I don't think
right,
because you got a pound of sugar and butter, So I'm glad I made it through that because he was a big boy and he took exactly what he needed.
Oh wow! How much did he weigh?
8 pounds 9 ounces.
Oh, that's a nice
22 and a half inches long.
Oh wow! Okay,
he was a big one. Yeah. Okay, let's see. I had this question. I once worked with an older woman who suffered from a prolapsed uterus. Okay. Can you explain to the people what exactly a prolapsed uterus is and what is things that women can do earlier in life to kind of ensure that may not happen to them? Is there, any pelvic floor exercises or anything that women can do to help lessen the chance of having a prolapsed uterus?
Absolutely. And I'm so glad that you brought that up because first let's deal with the prolapsed uterus. Prolapsed uterus the cause could be from many things. It could come from after you had a very large baby. Yes. And then once you had a large baby, then your uterus muscles, the broad ligaments that actually hold them up, it could be like a little bit weakened. It could also be just from straining. It could also be from a weak pelvic floor muscle. The musculature of the pelvic floor is weakened. So there are exercises that you can do. And I wish I would have brought some diagrams to show, but if you look at the anatomy and physiology of the woman, externally you see the skin where the mons pubis is, and I could actually pull it up. I don't know, would it show on the camera?
It probably wouldn't show.
Okay. Well, and around that whole, you have the labia majora, the labia minora. Underneath all of that skin, and underneath the perineum is all muscle.
Yes.
It is all muscle. So several exercises you can do, like while you're sitting, you can do Kegel exercises. Yes. Kegel exercises or when you go to the ladies' room to urinate. Kegel exercises is simply if you're using the restroom and you have your stream of urine coming out, then right when that stream of urine comes out, then you stop it. So when you stop it, then you're actually using the muscles to actually control the flow. So you stop it and release, stop it and release, stop it and release. That's a Kegel exercise. Now, I describe doing it while you're urinating because once you do that and see what it feels like when you're urinating, when you're sitting down, you could do working or standing up, cooking or whatever you're doing. You could actually do like 4 sets of 25. And then that will help strengthen your pelvic floor's musculature as well. Also, if you have steps, if you just take a step and you just go up and down steps, that actually also strengthens the pelvic floor as well. Okay. In any type of constricting movement where you're like constricting the flow of the urine or you're just like clamping down, that will help it. If you're doing taking steps going up, simple walking would help as well.
Okay.
Yeah.
So that's it to strengthen the pelvic floor. Keep your pelvic floor strong.
Right.
Because the pelvic floor actually holds everything in a way, right? It holds all of that, all of your lower abdomen.
Well, it not necessarily your lower abdomen because the way that is, because your intestines and everything is in a different place.
Okay.
But definitely your uterus right, and your bladder. Okay. Because there is something called a prolapsed bladder as well.
Oh, really?
Yeah.
Okay. Yeah, because I like I said, it was 27 years ago I was working with this lady, and she was an older lady. She was a little bit older. And she was telling us about it, and I was amazed because I had never heard of that before, because a lot of things that maybe our grandmothers or aunts and stuff was going through and, in life, older women, they
didn't talk about
it, so, but now with, like I said, social media age, people putting their business out there and they just, and people are feeling more free to talk about things that was once people suffered in silence, dealing with it. So now people feel more free and open to talk about those type of things, which that leads me into this next question. I said, do you find that a lot of women are ashamed or too timid to talk to their healthcare provider about any of the problems or questions or concerns they have concerning their private parts?
Once a woman comes into the room, I have not experienced that they're uncomfortable or that they're shy. Okay. There are certain questions that we automatically ask. And once we start asking once I start asking those questions, then the barrier is down, especially when it's just the patient and myself in the room. Now, oftentimes I've seen if they bring a significant other or a family member, they are more reserved. So I always ask when it's time to do the interview questions or assessment questions, then if there's someone with them, then I'll ask them to just kind of like sit in the lobby in the back before I bring them in. Okay.
It doesn't make sense.
Yeah.
Yeah, I'm assuming, especially with it being woman to woman, because I think a lot of women, I've heard of a lot of women requesting a female doctor or a female nurse. For me, I just looked at them as being a professional. They went to school to learn this thing that I don't know nothing about. So I didn't care who I got the information or the help from, long as I received it. So I know that I'm sure a lot of women, especially I think different cultures and stuff like that, they want a woman to kind of, look at them, because of some things some cultures you can't look at certain women because of their religious belief, and the coverings and stuff like that. So I'm sure a lot of those women have to have female doctors.
Yeah, they would prefer. And even bringing up culture in the African American culture, it is so important because there's been a thing in the healthcare community. I noticed it 26 years ago, where there has been disparity in regards to the care that African American women receive. And when an African American woman says that she's having any type of symptom, chest pain, or presents with anything, the way that it's treated in comparison if a woman of another ethnic group would present with the same concern. So I realized this 26 years ago, but to show you that how much it is impacting all over the healthcare industry, and even in the American College of Nurse Midwives, we have to do certification packet renewals every year. And I would say about almost 50% of our continuing education was on the fact of what needs to happen and highlighting the fact that there's disparity in how African American women are treated in women's health. So I brought that up to say, make sure that you advocate for yourself. Yes. Make sure if you are presenting with a particular symptom or something that is just simply not normal or you're concerned about, make sure that you are advocating for yourself. And if you are not being heard, then you have a right to go to another provider that will actually listen to what your concerns are.
Michelle sat there and said the same thing about with the kidney disease and show, and Dr. Shirley Jones said the same thing.
It's an issue.
Yes.
It is a major issue. And to be honest with you, I noticed it when I graduated from Florida A&M in 1999, and I started working in a particular labor and delivery unit. And I noticed how that there was disparity of treatment with African American women. And I noticed how there were providers that were saying things like, oh, she's just big, so her blood pressure is up, or, oh, and it was like, what?
Yeah.
Oh, of course she has diabetes. She's Black. Yeah. So, wow. So there are, and these are things that are not talked about. And to be honest with you, when I was younger, as a new nurse coming out of school, I graduated from Florida A&M. And although at FAMU, I was told that my position, that I was there to be an advocate for all people, but always be an advocate for patients when you hear things going on. When you're in that environment and you're hearing different things going on, it is very shocking. And one thing, I'm always the advocate for the underdog, for anyone. And there's a price to pay for that. There's a price to pay for that when you are standing up against systems in this world, in industries, but stand anyway.
Yes, I agree.
To the young nurses and to the young midwives that are coming up, stand anyway. Because we need that, because it took over 20 plus years for the voice to be heard that this is a problem. And it's not a new problem, it's a problem that has existed, not just with African American women either, with African American men as well.
Yeah.
But more so, we're bringing up African American women because for so long, it wasn't even an issue for women to go and get health care.
Yeah.
It was always about the man.
That's true. That's true.
Yeah.
I want to ask you now about what can a woman that's suffering from low libido, what can she do to help improve that? Is it only like medicinal, like just with pills, or?
Absolutely. You know what? Big Pharmacy really did a number on us. There are times when you do need to take medications. But there are also times when to get to the root of the problem is sometimes it's not a physiological problem. Sometimes it could be a mental or emotional problem. There's something, and I'm glad that you brought this up because I was hoping we would be able to talk about this. There's something called epigenetics. Are you familiar with that term?
No, never heard that term.
There's been studies that show, first of all, epigenetics is we have something called DNA. So our DNA carries like the messengers of what everything that we're going to be, and we pass down to our children. So it carries our genotype and our phenotype. It carries what our eye color is going to be. It houses everything that you passed on to your grandkids, that they're going to pass on to their grandkids, is in our DNA. Epigenetics, it is basically, let's say, for instance, if your great-grandfather was a slave, and he was a slave that lived on a plantation, and he was hung, or he was tormented in some type of way. He experienced trauma. Well, that trauma that your grandfather experienced did not just stop when he died. When your father was conceived, that trauma was also passed down to your father, who also passed it down to you. And you have passed it down to your son, and your son has passed it down to his children. So epigenetics comes into play where there are things that has happened that is actually impacting and altering the actual way that our genes and cells respond. Okay. And this is something that research has currently it has been acknowledged that it has impacted people, period, especially people that have gone through trauma. Okay. So I said that to say, whenever you go through a traumatic experience, for instance, your grandfather went through his experience, and then let's say you go through a traumatic experience. When you face trauma, you're not just dealing with the trauma that occurred to you, but it is being superimposed with all the other trauma that you inherited. Now take a moment and imagine that. Yeah. That's a lot. That's a whole lot of trauma to deal with. Yeah. And then what if you're not, what if no one, because we're calling it trauma, but trauma is also termed stress. Yes. So a lot of sickness and disease is a manifestation of stress. So dealing with the libido. For women, sex is not, having intercourse is not just Men can just have sex, and it means absolutely that they don't. They can just have an erection, have sex, and they're done. Mm-hmm. As long as they're not having ED, erectile dysfunction, or anything like that. Mm-hmm. But for women, it is a very emotional and mental exchange. So if you're not emotional or mentally whole, then that in and of itself is going to affect your libido. Okay. Women are nurturers by nature. They are caretakers. So if you are having to consistently pour out professionally, if you're having to consistently pour out in your home and nothing is ever being replenished on the inside of you, mm-hmm. then naturally your libido is going to go down, because we are made up of not just a body, but you have a mind and you have emotions. Yeah. So you have to be whole in order to engage. So if you're not, then that's going to interfere with your libido. So now what do we do? Mm-hmm. Well, it's a chemical response, and there's something called dopamine. Okay. Dopamine is our happy mm-hmm. hormone. Yes. So how do we get our dopamine going? So simple exercise, walking, meditation, mm-hmm. all of that can get, your dopamine flowing. Mm-hmm. Going and dealing with the issues that you have not dealt with. Mm-hmm. Okay. Sitting, journaling. And then if it's a physiological problem and that is still existing after you go to and get counseling, go to therapy and doing, if walking and all of that is not helping or combining it all, then you can look into perhaps some prescription. Some medication. Right. But I'm not a fan or an advocate of just prescribing something and not dealing with the root of the problem. Okay. Because if there's a symptom that presents, then that symptom is caused by something. Okay. Let's see. I got two important ones. I definitely want to get it out here and get it to the public before we have to wrap things up. One of my other questions is, should women with the same partner for years get tested for HIV or STI? Should they get that yearly with their exams? Why and why not, if they've been with the same partner? You better. That don't mean he been with you, huh? Right. You better. Okay. You better. Okay. Yeah, definitely. Because for that self-same reason. Mm-hmm. I've been in this industry for 26 years. Mm-hmm. And I have seen some things. Yeah. So to always advocate for you. Always advocate for you. Do what you need to do for you. Plain and simple. Okay. Yeah. And the other thing is... And let me mm-hmm. say this too. If just because you've been with that same person, mm-hmm. it doesn't mean that, because something like HIV, they could have had it when they got with you, mm-hmm. but you just didn't know. Yeah. They didn't know, you didn't know. So it's always important to just get tested. Just to get tested. Get tested no matter what. Okay. And another question is, at what age should a mother start taking her daughter to the gynecologist, her young daughter? Or is that an individual preference? That's an individual thing, but because now we have young girls that are starting their menstrual cycle in the first grade. Yes. Second grade. I went to school in the 80s with a girl in the third grade, and we didn't know what was going on. Yeah, because of the hormones that are being added to food, mm-hmm. and the body is just responding in a very different way. So I don't want to put an age on it because mm-hmm. of the simple fact that young girls are experiencing different physiological changes mm-hmm. that is taking place in their body. So it's not a specific age, but definitely if your child is in the first grade and she's starting to have a cycle, or if they're starting to go through different hormonal changes that you're noticing, starting to go through puberty or pre-puberty, I think that's a good time to just bring them so that they can become familiar yes. with the process and get questions asked. I see a lot of moms bringing their daughters, and the daughters actually feel better talking to me or to a provider than they do talking to their mom.
To their mom.
Yeah.
Okay. Before we get out of here, I just want you to get a chance to just to let the general public know some things concerning women's health and maybe testing, things to look for and things that they could do to make sure that they stay on the other side of being healthy. Just what is it something that you think the public should know?
Well, there's a lot of things that that the public should know. First of all, I want to advocate making sure that both men and women are doing self-breast exams, making sure that they're doing the exams at least once a month. We promote you can take your birthday. My birthday falls on the 27th. So the 27th of each month, actually doing your breast exam. Make sure that you're feeling to see if there's any pea-sized masses, any grainy type masses, anything that feels like long rice. You do that every month at the same time so that you are familiar with what your breast feels like, right? And also, I can give you information and you can post it on your website as far as with instructions on doing that. Men and women do breast exams, making sure that you're getting your pap smear done, making sure that you're getting your blood pressure checked regularly, making sure that you're getting your blood sugar checked. Now, here's the thing, especially with African Americans, when you get your blood sugar checked, I had someone say, oh, I got my blood sugar checked and my blood sugar was good. And I'm looking at clinical manifestations that I'm thinking, no, your blood sugar might be good, but did you get your A1C level checked? Because a A1C level shows what your blood sugars has been over a 90-day period. So your blood sugar might be good today.
That day.
That particular day. But if you look at it over a 90-day period, then that will give you really what's going on. Heart disease is one of the top 10 diseases that are affecting all women, but especially African American women. Diabetes is another disease. Cancer is another disease. So all of your screenings to prevent heart disease, all of your screenings to prevent cancer, all of your screenings to prevent diabetes, I highly recommend that you get those done.
All right. So there you have it, you guys. Go get yourself checked out. You know, we done said it time and time again on this show. Be an advocate for yourself, stand up for yourself, and take care of yourself. Always be proactive moving forward with your health and just try to maintain as healthy of a lifestyle as you possibly can. I recommend no smoking. I don't believe in smoking nothing.
Definitely.
So that's just me, but to each his own. It was a pleasure having you here.
Can we add one other thing? Because someone might wonder, well, I don't have insurance, so where could I go? You know, so, and that's often a barrier to people getting health care. So if you do not have health insurance, do not let that be the reason why you're not getting yourself checked. Duval County has an absolutely phenomenal health department. There are also other providers, both gynecologic and primary care providers, where you can actually go and you can do self-pay. University of Florida has a unique program that you can go to. And I know people don't like to go to Shan per se, but do not stay away from getting yourself checked and getting the baseline of knowing where you are. Do not stay away from doing that for yourself.
All right, you guys. Once again, this is Views on the Round Table. We had the pleasure of having Tresonda LaRalle
Yes, ma'am.
on the show today. It was a pleasure. I enjoyed the show. You guys, thank y'all for tuning in. Y'all be blessed. Have a good night.
Good night.